I'm John Batchelor. This is the John Batchelor Show. The Affordable Care Act, Obamacare, it's coming. It's not quite the same as a thriller movie you're expecting, but it could be worse. Larry Kudlow of Kudlow Reports, my colleague and co-host of CNBC, continues with me, and we welcome Joseph Rago, Joe Rago of the Wall Street Journal editorial board, the Pulitzer Prize winner for his groundbreaking remarks and publications about the Affordable Care Act in 2011. Here we are in 2013. So far, only two small interpretations have been delayed a year, according to the Obama administration. One, the employer mandate. The other, the enforcement on people who say they are eligible for subsidies or say they don't have health care provided by their employers. But as of now, there will be no audit of their statements, at least for a year. Joe, a very good evening to you. These are two small matters, I'm told, by the Obama administration's defenders, the apologists. Are we expecting more delays or pieces of the train to fall off on its way to glory? Good evening to you, Joe.
John, how you doing? No, I mean these are major delays. First of all, and second, this is being run like a clandestine operation. We're really not being given a lot of transparency on how well the Department of Health and Human Services is doing. There was a remarkable hearing last week where HHS was before Congress, and they said, "Don't worry about it. These are just two small programs. Everything's fine. Everything's on schedule." And sitting right next to HHS was the HHS Inspector General and the Government Accountability Office, who are kind of in charge of auditing the progress of implementation so far. And they said, well, wait a minute, they're not even close to ready. So I think these are the first things to fall, but there will be more in the months ahead.
Joe, I don't understand how you can maintain the individual mandate, which is where the real money is to finance these subsidies and whatnot, if you cannot verify the eligibility of the people presumably applying for the mandate. I just don't understand how you do that.
Right. Well, Larry, I think the goal on the part of the administration to prevent to sort of mitigate the huge amount of rate shock that we're going to see coming. Premiums rising 20 to 30%. They just want to pack as many people in to these exchanges as possible. And if they say they're eligible for subsidies, well, we'll give you subsidies. So I think it's really kind of a rearguard action to defend this program in its early years and essentially get so many people hooked on these benefits that it can never be repealed. Well,
all right, so let's go down the list. There are other things that interest me about this. Let's talk about the exchanges themselves. In some 30-odd states or more, there are no exchanges. There is no infrastructure. Nothing has been set up. So before we get ready to dump all these people into the exchanges, where are the exchanges?
Right. Well, that's one of the big unanswered questions. If the 43 states or whatever it is, 34, who've declined to run these exchanges, HHS is supposed to step in and run a fallback exchange. They really haven't told anyone how they're going to run those exchanges, which insurers are going to be providing policies there. That's one of the largest unanswered questions. I mean, this is a majority of the country and really the biggest part of the Affordable Care Act. They haven't said anything publicly about where this stands.
And then another one is I read all the time that young people who may be the backbone of this thing or financing it don't want in. They don't want to pay the hike in the premiums. They don't want all the bells and whistles, and they'd rather pay a penalty. So there's a financing problem compounded by the absence of the younger people.
That's right. I mean, the regulations in the Affordable Care Act essentially create up a transfer mechanism where insurance has to be vastly overpriced for young people, and for older people or less healthy people, it's vastly underpriced. So it's a transfer from one group to another, but the group that gets hosed can just say, well, to hell with it. I'm not going to participate in this. And then you get what's called an insurance death spiral where premiums just keep rising and the subsidies keep rising and the market collapses.
Joe, I want to use an argument that has been presented to me by apologists for the Affordable Care Act. The Medicare Part D, the Bush administration initiative back 10 years ago, I'm told that there were many problems in initiating and introducing that, and things didn't work right away, and it was finally worked out. And that will be a model of what's going to happen to the Affordable Care Act. How is that argument?
Right. Well, if you look at the prescription drug benefit program, that was just providing medicines to people who are already enrolled in Medicare. This is enrolling all kinds of new people and rewriting, 17% of the economy. So I'm not sure it's the best analogy in terms of the problems. I think there will be many more problems with the Affordable Care Act as opposed to Medicare drugs. But in the long run, they might be right. Just get everybody hooked up to the intravenous drip of subsidies, and suddenly the program is part of American life, and you can't touch it without getting accused of throwing grandma off a cliff, or in this case, the poor uninsured.
All right, so here another one. What are they going to do in all these public unions? Let's go to Detroit, Joe. It's your basic bankrupt city now. At some point, Detroit is going to dump as many of their public municipal union guys who are going to get damaged.
There are about 20,000 pensioners in the city of Detroit.
I mean, they're going to dump them into the exchanges. Now that is nowhere budgeted, and there's probably lots of Detroits out there.
Oh yeah, if you look at Chicago, they're already planning to dump their retirees onto the exchanges. So yes, I mean that's part of the reason this bill was so deceptively sold in 2008 and 9 and 10 when they said this is just a very limited program. This is what George H.W. Bush supported. The truth is the costs here are going to be far higher than were ever predicted, at least by the law's supporters.
And your information, Joe, is the administration confident that it knows where the problems are so that it can anticipate, it can get out there and speak ahead of time, it can introduce the intricacies to a public that's puzzled and a little frightened?
Well, I think they have a lot of cockiness. They think they can, just like they turned out young and minority voters in 2012, they think they can do the same thing here with health care. And the difference is that votes are free. This is something that affects people's month-to-month finances. And, in some cases, the plans will be very cheap, but they'll never be free. And a lot of people just get a bad deal where they pay a lot for not a lot of economic value in return. So who knows? Everything could go swimmingly, but I really have my doubts that.
And when you say cheap, that's after subsidies. It's cheap, correct? You have to apply, you have to qualify, you have to fill out a lot of forms, and then you get money back, or you're given a subsidy.
Right. Well, yes. The premiums will offset the cost of higher cost insurance, but it won't offset all of it. And so, if you have somebody who's young and just starting out in life, starting their career, generally low income, little net worth, this is still going to be a big imposition for them.
I don't see, with these public union dumps, the lack of verifiability, the fact that the exchanges aren't set up, young people are not going to go into it. I just don't know how you do this. This is different than George Bush's drug program. This is like starting from scratch, and building yourself a gigantic house. I just do not see how they can do this.
Joseph, because we're on the edge of it, and because October 1st is one date, January 1st is another, is there a timeline you can give us when things either fall off or we know that they're starting to work? Is there a moment? I mean, it's just a couple of months till October 1st. Labor Day, is that a moment to watch for?
Right. That's when the exchanges open for enrollment. And I think that's when we're going to see a lot of operational difficulties. Do these websites work? Do all the sort of computer systems and information technology, do these things actually work? If Obamacare was a new line of business for a tech company, they would spend twice as long and twice as much money getting it ready for its public debut. I think we'll find out on October 1st if this is Apple Maps instead of
and do you mean
Google
nationally?
Maps,
Do you
right?
mean nationally or just the states that set up exchanges? Is that for both?
That's for both. It's nationally.
And what are the Republicans in the House going to do about all this money that doesn't exist and they're going to have to appropriate?
Yeah, I mean, that's a big problem right now that we probably don't have time to discuss, but there's a real schism in the GOP conference about how to proceed going forward. Do we throw in all or nothing and shut down the government to avoid spending extra money on this program, or do we try to take it apart piece by piece using whatever leverage we have? I don't think they've come to a conclusion yet there.
The Pulitzer Prize-winning Joseph Rago, the editorial board of the Wall Street Journal, the countdown till October 1st. I'm John Batchelor with Larry Kudlow of Kudlow Reports at CNBC and Kudlow Radio across the nation on the weekend. This is the John Batchelor Show.